Hello, and thank you for joining us. This is Health Matters on Channels Television. I am Mary Alale Yusuf. There are now over 180 million cumulative cases of COVID-19 globally, and as at Friday, June the 25th, the death toll was over 3.9 million. In Nigeria, there were more than 167,000 confirmed cases of COVID-19, more than 163,000 recoveries, and 2,119 deaths. That makes a total of 275 new infections, 397 recoveries, and 2 deaths recorded in the week between June the 18th and 25th. Recovery rate is very close to 98%. Case fatality is about 1.27%. Over 2.2 million samples have been tested, and more than 2.9 million vaccines have been administered in Nigeria. Now let's go to the topic of the day. Think about a blood disorder that is passed from parents to children, a group of disorders in which red blood cells are distorted into a sickle shape. Sickle cell disease was first recognized as a public health problem in 2008 at the United Nations General Assembly. 75% of the world's sickle cell disorder occurs in Africa, and in Nigeria, 2 out of every 100 children born has sickle cell disorder. The National Director and Chief Executive Officer of the Sickle Cell Foundation in Nigeria is my guest. Dr. Annette Akinshete is also a consultant public health physician. You're welcome to the show.
Thank you very much, Mary.
You are the person for this topic.
It's the matter of the moment.
Why are they calling it a public health problem? What was it that sparked that?
Absolutely. Well, it's something that we had been kind of fighting for a long time. But you know, sickle cell is a condition that doesn't really affect everyone in the world. It traverses the entire world. It's kind of restricted to parts of the world and along the tropics. Because remember, people usually say it's an African man's disease.
Yes.
It's a black man's disease. That's not really the case.
There's
You find it in the tropics, sub-Saharan Africa, across to the Arabian Peninsula, to the Asian subcontinent, and as far away to the east as the Indonesian archipelago.
Can we say anywhere we see mosquitoes?
Absolutely. Anywhere you have malaria, not so much
malaria.
Mosquitoes. Anywhere you have malaria. There's that relationship between malaria and sickle cell. I think we've discussed this here on Health Matters before, how in a way it's protective. The sickle cell gene protects against malaria. The mutation occurred really to save the species, to ensure that the species survives. Because I think nature has discovered that those who were AA, I think I want to assume that that's what people know we're talking about, died off from malaria. But then when the sickle gene combined with the A, the sickle and A combined, they were sort of protected. There was a protection.
But now we have a problem.
Severe cases of malaria.
This sickle-shaped cell, ordinarily people will think, big deal, it's even slimmer, it can move faster. What is the disadvantage?
Absolutely. Now, you know, a normal red blood cell, you know, we have 3 types of, remember your biology? I know you do.
We have the red blood cells,
white blood cells, and platelets.
platelets.
Absolutely. The red blood cells help us to carry oxygen around the body. The air that we breathe, we extract oxygen from it, and that's what, you know, completes respiration throughout the body. Now, that red blood cell normally is round-shaped, like it looks like a donut, you know, with a dimple in the middle. So it's able to glide, and it's flexible. It's able to glide through the vessels with ease. Okay, but when you have the distortion, like you rightly said, when the cell is misshapen and shaped like a sickle. By the way, that's why they're called, many people used to call them sicklers. We don't even use that term anymore because their cells sickle when they're dehydrated, when oxygen tension is low. Okay, but you know what? Something else? That cell is not supple, it's not flexible, it's rigid. And
can't carry enough oxygen, I guess.
It's not efficient. You know, the hemoglobin in it, hemoglobin S, does not allow it to carry oxygen efficiently around the body. What more importantly, it doesn't live long in the body. The normal red blood cells will live up to 120 days in the body, 3 months. Whereas the sickle cells, between 10 and 20 days, they're gone. They're broken down and they're eliminated from the body. So that's why part of the problems we see is anemia, shortage of blood.
That would wear down the body, wouldn't it?
Absolutely. In fact, you know the name now, because Yorubas have come up with better names for sickle cell than what they used to call arumolegun, which spoke to the pain, I guess. But now you hear them speak of shejedole, which means makes the blood weak or lazy. In other words,
Fantastic.
blood that's not
Strong enough.
Exactly. So they tend to have
Fantastic.
anemia and all that. So that misshapen cell is also able to not able to glide through and begins to clog. The ends, the corners, shaped like a sickle. I like to say
They
shaped
get
like
stuck
a
in the
crescent moon.
vessels.
Exactly. Or shaped like a
Especially
banana.
the capillaries.
They're not able to glide. So they begin So they begin to clog or block or occlude the vessels so that blood does not get to the tissues or to the end organs. And what happens is that those organs, tissues are starved of oxygen. And the body's way of saying there's a problem here is what? Pain.
Pain.
That pain. This is why pain is a hallmark of sickle cell.
Okay, so the person now has a crisis once in a while.
Yes, we call the sickle cell sometimes bone pain crisis.
And that's because of this clumping in the vessels. So that pain comes. And is that what a crisis is?
Okay, that's one type of crisis. There are others as well, but that's the one we usually talk about, and that's what usually brings patients to hospital. Pain, pain, pain. Mary, that we've discussed how sometimes patients are asked on a scale of 1 to 10, where is your
Yes,
pain?
where's
And they
your
tell you
pain?
It's 20. In other words, it's through the roof.
Yes.
Or those who have had children compare labor pain with sickle cell bone pain crisis, and they say labor pain is child's play. So that gives you an idea.
No, I know sickle cell pain is really painful.
Yes.
Because I've seen somebody suffering it. And do you know what he said? He said his chest was tearing apart.
You see, that's another way. See, how to describe it in different ways. Others will say we can't even localize the pain. I don't know exactly where the pain is coming from. So it is severe. You asked something else just now about besides pain. Yes, there are other crises. There's something we call, you see the abdomens may swell up. The spleen is an organ in the left upper part of the abdomen. It's also part of the organs that help us with our immune system. The spleen may just suddenly get very enlarged. It pulls blood cells, red blood into itself, and then starves the body of blood that it requires. That's another kind of crisis. But that causes sudden anemia and can be potentially fatal.
Do you think most people with this problem are being discovered now? I know before it wouldn't have been like that. They would just say something's wrong with the child.
Exactly.
Please let him just die off and let me have another one that will live. Something like that. But are we getting them? Are we picking them up?
I would say definitely yes. Because I've been in this business for a long time, since I was in the 80s as a very young doctor with Professor Kuti as our Minister of Health at the time, when we started looking at sickle cell as one of the non-communicable diseases in Nigeria. And then we went all over the country, finding out how much sickle cell we had. At the time, awareness was low. Really, really low, to the extent that people hid their children. They would not tell you that I have a child with sickle cell.
Yes.
But now, because
it was like a taboo.
Exactly. We still go into the communities. And now I like to say there's what we call name recognition. Even in English, they will tell you, my child has sickle cell. In English, and they would sometimes describe it in their own language. And then we're hearing less and less of Abiku.
That's right.
We're hearing less and less of Ogbanji. They still talk about it, but not as much as they did in the past.
So it's getting better and
awareness
better.
is definitely improving. And I give kudos to sickle cell NGOs, sickle cell advocacy groups, because they've really gone out and fill that gap. Because I know that government is doing its bit, but really not enough in terms of ensuring that all the nooks and crannies of Nigeria get to know about sickle cell. So I think the sickle cell advocacy groups have filled that gap and are really working.
Before we go into bone marrow transplant, which I'm really excited about, let me just quickly ask you, apart from bone marrow transplant, can a sickle cell patient be treated such that you handle the pain and the crisis?
Oh, yes. That's exactly the goal of management of sickle cell, to ensure that they live normal, productive, pain-free lives as much as possible. So that's the goal. And what do you do? This treatment. So we always encourage them. So the sickle cell is treatable, it's manageable, and there are better drugs now that are actually prevent the crisis from occurring. Called like hydroxyurea.
Very important.
In the past,
crisis.
Our doctors were a bit wary about embracing hydroxyurea as treatment for sickle cell. But more and more of them are coming on board. This was a drug that was initially meant for treatment of cancer.
Okay.
But it was discovered that it was very helpful for sickle cell. It helped. What it did? It helped to bring up the level of hemoglobin F
Okay,
Hemoglobin
that's a
F is
fetal
exactly
hemoglobin,
That's the type you
which
have
is normal,
in your
right?
mother's womb. It works like A. It's
Okay.
just as efficient and as effective as hemoglobin A. So the patient begins to act like like an AS. So that's what it shows of that level of hemoglobin F
Even when
in the
they're
blood.
old, if it's an older
Yes,
patient,
children and adults. Children and adults. So, like I said, our doctors are getting more comfortable prescribing it. And that's one of the things we do in our center in Sickle Cell Foundation Nigeria, where we train doctors and retrain. We do it annually, really, to ensure that doctors are on board with the current management, contemporary management
so
of
more
sickle
often
cell.
than not, if there's no permanent cure or no bone marrow transplantation, you can assure your patient that they can live a pain-free life.
You can live a normal
and have
pain-free
less
life crisis.
crises.
Because besides the treatment with hydroxyurea, which is better and gaining traction, patients with sickle cell, usually many of the doctors prescribe what we call chronic transfusion. Every 3 weeks, they need to be transfused.
every
But
3
it really
weeks.
doesn't, what we found is that it's fraught with a lot of challenges.
And we don't
here.
have a very good habit of blood donation yet.
Absolutely. Now you see what I'm talking about. We still have problem or crisis with blood availability, and also sometimes cultural and religious barriers
Yes.
to blood to accepting blood transfusion.
So the hydroxyurea is a
fantastic.
good alternative.
Honestly, so it's come a long way. Besides that, when it's a crisis situation, though, you can doctors will say, let's exchange blood transfusion. So they take out a lot of sickle cells and replace with an AA cells. And so the patient does better. And sometimes the child may have what we call acute chest syndrome. That's also called for exchange blood transfusion. So these are things that remedies that help, besides the usual folic acid that you give every day to ensure that their blood is replaced and replenished. We don't give iron, remember?
Yes.
That's one of the things, because they have a lot of iron. Like I told you, the blood cells break down so rapidly that the iron stores just are increasing. If you give more iron, because you say they're anemic, you're actually poisoning them and overloading the liver.
And one really needs to know that.
To prevent
So don't be treating your sickle cell,
with iron.
At home
syrup,
even.
yeah.
Take the person for management, right?
Absolutely. So that's it. And I think more of people are understanding more about that. And that's the work of most of us.
And we love them. We're not
space.
going to discriminate against them.
No. We talked about that before we came on air now.
Yes.
That is part of the laws that we're talking about. Should be, because we know how expensive it is to treat these children, let's ensure that health insurance covers, they have that health insurance cover. So let our laws cover this. And I was speaking to a number of legislators to try and convince them about this is at the national level, where they had a bill that they wanted us to discuss. I said, good, thank you for inviting us. We discussed it at last. The bill should actually provide for free treatment for children under 5.
Oh, yes, definitely. Because for 2 out of every 100, that's a large part of your population.
Exactly. And you know something else? This area of Sustainable Development Goals, SDGs, the SDG 3 is health, remember? Under health. And under health, there's a target that says we must work to reduce under 5 mortality. And if 150,000 babies are born every year in Nigeria, and 100,000 plus of them die before the age of 5, if you deal with sickle cell, you will reduce that. It will be low-hanging fruits, really, for Nigeria. So we can boast.
Can you believe that?
We have reduced.
We've come to our break time
already.
Already. So we'll take a short break and come back and continue. Please stay with us. We are coming back shortly. Welcome back. It's sickle cell disease we're talking about on Channels TV, and this is Health Matters. Believe it or not, this concerns everybody, because if you don't have sickle cell disease, you'll know somebody who has sickle cell disease, or you'd be a carrier. It's just like that. We're Nigerians. So let's quickly talk about the only cure we know so far, which is bone marrow transplant.
Absolutely.
Which has come to Nigeria.
Absolutely.
Tell us a bit about that.
And excitedly. Thank you, Mary, for asking that. And indeed, that's we like to say that there's light at the end of the tunnel. Thank God there's a cure. Before they used to say it's one of the diseases that has no cure. I saw Tio Bogun, I think he's in Yoruba. But now it's Ogun, as they say. In any case, this is it. Bone marrow transplantation is the only cure we have for sickle cell today. And guess what? Sickle Cell Foundation Nigeria has established it in Nigeria and in Lagos, in collaboration with the Lagos University Teaching Hospital with a technical partner from America, Vanderbilt University.
Oh, Vanderbilt.
Medical Center. In fact, the director of transfusion, blood transfusion, bone marrow transfusion there is a Nigerian-born Dr. Kasim. He's our visiting consultant. And
I
he'll
shouldn't be
with us.
saying this, but we're the best.
Absolutely, everywhere in the world. No, but you're right, Mary. Everywhere, Nigerians are really more than holding their own. They're really flying the flag. So he's been holding us by the hand, teaching us, guiding us. As we speak now, some of our doctors are out there in training. So as soon as the return will begin, we're opening our doors to the public in July 2021. That's next month. And we're really very thankful for that. There'll be formal commissioning before that. I can't talk too much about it. In any case, let's talk more about what is.
So
what
someone
it is.
gets a bone marrow transplant.
Absolutely.
What is the
it?
change in his life?
Very important. Someone who was SS, sickle cell SS, is now becomes AA.
Wow.
Or AS, depending on who the donor is. Okay. What our protocol is that we take only sibling donors.
Okay.
Brother or sister.
Because of the chance of success.
Remember? Yes, exactly. So we're keeping ours very tight. You're closer to your brother and sister, your siblings, than you are to your father and mother in your gene pool.
Oh, is that right?
Because you have, yes, you're half
Okay.
of your mother, half of your father. Well, you and your brothers and sisters share the same gene pool. So you're more likely to have a sibling who's a full match than your father and your mother. And that's the kind of donors that we use. And that's our protocol number one. Mind you, bone marrow transplantation is not for everybody.
Okay.
Not everyone is a good candidate for it. So doctors who do it are very, very selective so that their success rate is like 99%, but they're very selective. So when they look at you and your criteria, they say, what are the criteria that they consider? How many crises a year? Does the child have stroke? Are there strokes? Are there other complications there? They weight these things and determine if indeed there's that risk is necessary. Because it has.
But what if the
risks.
child has been doing a fine transcranial Doppler and his strokes have been, preempted? So he's not having strokes?
Yes.
Is he a good candidate?
They will determine. They weight these things. They weight that's one criterion. They add that to what other crises, other complications, and they determine, okay, you are a good candidate or not. So let's put it out there, not everybody is a good candidate, but it's there. Why should Nigeria not have it? Nigeria should have bone marrow transplantation because we are the country with the highest burden of sickle cell in the world. Our patients are going everywhere in the world asking to be receiving bone marrow transplantation. Now, guess what's happening? We're getting inquiries from the US, from the UK, from Europe, from India.
Are you saying people want to come back?
They want to come to... No,
why don't they have...
Nigerians abroad and even non-Nigerians abroad are asking to have their bone marrow. We have a long list of people on the waiting.
Okay, the thing is, what is baffling me is why are they ready to travel down here
because
when the facilities are there?
At the end of the day, it will be much less expensive here.
Okay.
It will be much less expensive because out there, it's about $500,000 dollars.
Wow.
In the UK and the US, between $400,000 and $800,000. That's an awful lot of money. So, but people, because of what it does, it changes their lives. It's like a new lease of life. But remember,
no crisis, no pain,
nothing. So but something, Mary, that's very interesting about bone marrow transplantation. Those who have it will tell you there's absolute need for multidisciplinary care, psychiatric care, psychological, clinical psychologists, counseling, absolutely necessary before, during, and after. Because patients who have had it, I've seen the patient who came to us and said, he'd rather go back to his sickle cell body because he was used to that. He had lived with that for 30-something years. But of course, all he needed was more therapy, counseling,
and just somebody to talk him through.
Absolutely.
And then perhaps meet other people who have had the procedure.
Groups, exactly. That's what we are doing.
Help.
We do we're going to be doing family matches. So discussing more about what it does, the bone marrow transplantation itself, what it does, apart from making sure that now you're AA, not AS, or not SS, you're able to do everything else that we're not able to do. There's one video of one of our patients who accessed the treatment abroad, through Sickle Cell Foundation Nigeria. Says now he can do exercises that he never did before because physically. Normally we say, mind yourself, know your limitations.
Yes, be careful. Don't get too hot. Don't get too cold. Don't run too much.
So that cure is available now. Just let Nigerians know that we have it here in Nigeria for Nigerians. And for Africa as a whole, for the world. We're open to the world.
You were telling me about something else that can be done, for people who you know, they ended up being AS and
Exactly.
AS, and they might have a child who has the sickle cell
Absolutely.
gene.
I
They do something before they have the child. Please explain that thing.
Very correct. Yes, I have a young lady who came to me and said her mom was very upset with her because she's planning to marry someone who's AS like her. They're both carriers, and said that her mom had said over her dead body. But guess what? She's won her parents over now because they're going for this, because of science. They're going for a procedure known as PreImplantation genetic diagnosis. PreImplantation genetic diagnosis. It speaks for itself. What it means that before the embryo is implanted in the mother, you'd have made the diagnosis in vitro in the laboratory.
So they will know that this child is not going to be SS
exactly
when the child is born.
The father's spermatozoa is mixed with the egg from the mother, and in the lab they determine which embryos are free of sickle cell, and that's what they infuse in the mother, and she carries that to term.
Tell us again why you don't think it's right for the mother of that lady, for example, to do such a thing, for people to force their children not to marry who they want to marry. Why?
It's been going on for a while. Many churches forbid couples who are carriers to marry because they say they will marry them except they show proof that they are not carriers. But what we have seen is that they've come to us before, couples like that, to say, give us a falsified, we'll pay you, just tell us.
Just say I'm AA.
And they take that to the pastor and they're married. So see, what that does is it pushes the disease into the closet. People hide it. You know, they don't talk more about it. So what we should really be doing is diagnosing early. And that's why we spoke about newborn screening. So as early as first year of life, parents should know what their child has. If a child has sickle cell, if a child is a carrier, child is AC, whatever they are, they should know. Another opportunity is when children are going to school. We determine our genotypes. So we know early on, in secondary school, in universities, at youth corps camps, opportunities abound for us to determine early what our genotype is, not when we just walk up the aisle.
You did a very good job. Gave us a lot of information, even though we didn't finish, but time is up. Thank you for coming. Thank you so much. That was fun.
Thank you so much, Mary, as usual. Very engaging.
Thank you for being with us.
Very engaging.
Let's do it again next week. Have a wonderful day. I'm Mary Alale Yusuf.